A very good morning to all of you. Today we are going to do the pharmacology MCQ challenge. You can click the link in the description box to join my 3-day masterclass blueprint, which will be very helpful to take your preparation to the next level and improve your scores a lot. You can also directly WhatsApp me on the given number. So the drug in the delivery system given below is A. Topical use, B. Systemic use, C. Both topical and systemic use, and D. None. Here you can see that it is a transdermal patch. It is used on the skin, transdermal patch. So this transdermal patch, the drug delivery system is by a systemic route. Systemic route. So the correct option here is systemic use. Now moving on to the next question. Clinical effect of vitamin D is reduced by A. Simultaneous ingestion of phytates. B. Simultaneous ingestion of lactose. C. Acidic environment. D. None. So what do you think it is the correct answer here? A. Simultaneous ingestion of phytates. B. Simultaneous ingestion of lactose. C. Acidic environment. D. None. Simultaneous ingestion of phytate is the correct answer here. Now, what is the main clinical effect of vitamin D? The main clinical effect of vitamin D is to enhance the intestinal absorption of calcium. To enhance the intestinal absorption of calcium. With an average intake of 1000 milligram of calcium, with an average intake of 1000 milligram of calcium, the net intestinal absorption is about 150 to 250 milligram per day. Calcium is absorbed from where? Mainly in the duodenum and jejunum, that is the proximal intestine, by an active transport mechanism regulated by 125 dihydroxy calcitriol. Parathormone indirectly promotes the absorption of calcium by increasing the renal synthesis of 125 dihydroxy calcitriol. Now, lactose, proteins, dietary lactose, proteins, and acidic environment promote calcium absorption. Ingestion of lactose, proteins, and acidic environment promote the calcium absorption. On the other hand, phytates, phosphates, oxalates, and tetracycline and an alkaline environment impair the calcium absorption. So simultaneous ingestion of lactose, acidic environment, they promote the calcium absorption. Whereas phytates, phosphates, oxalates, Anandamide is A. Opioid, B. CK1 antagonist, C. D2 blocker, D. Cannabinoid neurotransmitter. Now, what is anandamide? A. Opioid, B. CK1 antagonist, C. D2 blocker, D. Cannabinoid neurotransmitter. Now, what is this anandamide? The name sounds very fantastic. Anandamide. Anandamide is a cannabinoid neurotransmitter. Anandamide is also known as N-arachidonoethanolamine or AEA. N-arachidonoethanolamine or AEA. It is an endogenous cannabinoid neurotransmitter. The name is taken from the Sanskrit word ananda, which means bliss or delight, and amide. It is synthesized from N-arachidono phosphatidyl ethanolamide by multiple pathways. It is degraded primarily by fatty acid amide hydrolase, which converts anandamide to ethanolamine and arachidonic acid. As such, inhibitors of FAH lead to elevated anandamide level and are being pursued for therapeutic use. Which of the following drug is preferred in WHO stage 4 for the condition given in the picture? Now, what is this condition? Here you can see the prominent pulmonary arteries. Prominent pulmonary arteries. It is a diagnosis of pulmonary arterial hypertension. For stage 4 pulmonary arterial hypertension, the drug of choice is IV epoprostenol. So this is primary pulmonary hypertension and the drug of choice is epoprostenol. So the correct option here is C, epoprostenol. Acidic drugs bind to A. globulin, B. alpha 1 glycoprotein, C. albumin, D. none. Acidic drugs bind to. Now, many natural substances circulate around the body, partly free in plasma water and partly bound to plasma protein. For example, cortisol, thyroxine, etc. Similarly, drugs circulate in protein bound and free states. And the significant is that free fraction is pharmacologically active. The free fraction is pharmacologically active, whereas protein bound component is a reservoir of drug that is inactive because of this binding. The acidic drugs generally bind to plasma albumin. Acidic drugs generally bind to plasma albumin, and the basic drugs bind to alpha 1 glycoprotein, alpha 1 acid glycoprotein. Binding of albumin is quantitatively more important. So the acidic drugs bind to albumin and basic drugs bind to alpha 1 acid glycoprotein. So acidic drugs bind to albumin. The drug in the picture, the drug in the picture is used for A. breast cancer, B. routine contraception, C. emergency contraception, and D. abortion. Here you can see it is levonorgestrel tablet, pill 72. That is, it is an emergency contraception. Two tablets of levonorgestrel given in the picture are used 12 hours apart for emergency contraception. So the correct option here is C. Sugamdex. What is Sugamdex? Sugamdex is for A. Organophosphate poisoning, B. Reversal of neuromuscular blocker, C. Treatment of local anesthetic poisoning, D. Treatment of central anticholinergic syndrome. Sugamdex is used for reversal of neuromuscular blocker. Sugamdex is a novel reversing agent developed for terminating the action of non-depolarizing muscle relaxant rocuronium and vecuronium. This Sugamdex is a modified V-cyclodextrin with high affinity for rocuronium and vecuronium. It encapsulates one molecule of neuromuscular blocker within its molecule and an inactive chelate which is excreted in urine. So Sugamdex is used for reversal of neuromuscular blockers. Mode of excretion of cyclophosphamide is A. Lung, B. Liver, C. Kidney, D. Skin. Sugamdex mode of excretion of cyclophosphamide is A. Lung, B. Liver, C. Kidney, D. Skin. Cyclophosphamide is primarily metabolized 80% and metabolites are excreted in urine. 10 to 20% is excreted unchanged in urine and 4% is excreted in the bile. So the correct option here is C, kidney. Beta 2 agonist cause all except hyperkalemia. Now let us look what is up to beta 2 agonist. The adverse effect of beta 2 agonist, that is inhalational agonists are common side effects are muscle tremor and palpitation, hypokalemia, not hyperkalemia, hypokalemia, hyperglycemia, tolerance, throat irritation, ankle edema. Other side effects are anxiety, headache, muscle cramp, dry mouth, arrhythmia, flushing due to vasodilation, hypoxemia, disturbance of sleep and behavior. Now, what is the receptor given below? What type of receptor it is? A. GPCR, B. Ion channel receptor, C. Enzyme link receptor. Here you can see a pentameric structure. It is a nicotinic receptor made up of 2 alpha, 1 beta, 1 delta subunit. 2 alpha, 1 beta, 1 delta, and 1 gamma subunit. Nicotinic receptor is a sodium ion channel receptor. So this nicotinic receptor is an ion channel receptor. So the correct answer here is B, ion channel receptor. Duration of action depends on A. Clearance, B. Rate of elimination, C. Bioavailability, D. All. Duration of action depends on A. Clearance, B. Rate of elimination, C. Bioavailability, D. All. It is D. All. Which of the following drug can cause thyroid dysfunction? A. Amiodarone, B. Ampicillin, C. Ibutylide, D. Acyclovir. Now, lithium sulfonamide, phenobarbital, phenytoin, amiodarone, PAS, rifampicin, carbamazepine, all of them cause hypothyroidism. So the correct option here is A, amiodarone. Which of the following anti-migraine drug might have caused the side effect in the picture? Here the picture shows there is vaso occlusion and gangrene is there. Ergotamine can cause severe peripheral vasoconstriction and gangrene in organs with end arteries like fingers. So, the anti-migraine drug which can cause this is ergotamine. Dopamine, all of the following is true except causes increase in GI ischemia, B positive inotropic, C improves renal perfusion, D causes vasoconstriction. What do you think is the correct answer? Now this dopamine acts on dopamine that is D1 and D2 receptor and adrenergic that is alpha 1 and alpha 2 receptors with no action. At lowest effective dose, it stimulates D1 receptor in renal and mesenteric blood vessels. That is, it improves renal and mesenteric perfusion. At moderately high dose, it acts, it is positive inotropic. Positive inotropic. At high doses, it causes vasoconstriction. So the correct option here is causes increase in GI ischemia. The side effect of digitalis are all except. Now, what are the side effects of digitalis? Digitalis always causes mild vasoconstriction, not vasodilatation. So the correct option here is vasodilatation. The side effect of digitalis are all ventricular tachycardia, nausea, vomiting, ventricular bigamy, except vasodilatation. Antiandrogen used in heart failure is A. Carvedilol, B. Sampatrilate, C. Spironolactone, D. Abiraterone. It is spironolactone. Which of the following drug might have caused the side effect given in the picture? A. Antacids, B. Bismuth, C. Cisapride, D. Sucralfate. Bismuth can cause black discoloration of stool and tongue. So the correct option here is bismuth. Now let us move to the next question. Gemcitabine is mainly used in which cancer? It is pancreatic cancer. Maximum gemcitabine is used in pancreatic cancer. Maximum liver toxicity is seen with which anti-TB drug? A. Isoniazid, B. Rifampicin, C. Pyrazinamide, D. Streptomycin. Maximum liver toxicity. Maximum liver toxicity is pyrazinamide. Pyrazinamide. Fastest acting antithyroid drug is A. Iodide of Na and K, B. Propyl thiouracil, C. Methimazole, D. Nitrate. The correct option here is A. Iodide of Na and K. Iodine is the fastest acting thyroid inhibitor. Most important action is inhibiting of hormone release. So the correct option here is iododes of Na and K. Natalizumab is used in treatment of A. Multiple sclerosis, B. Breast carcinoma, C. Psoriasis, D. B cell lymphoma. It is multiple sclerosis. Special features of glargine insulin is A. It produces smooth peakless effect. It is not suitable for once daily administration. It remains soluble at pH. So correct option here is it produces a smooth peakless effect. Mechanism of action of tylostane is it is 3-beta hydroxysteroid dehydrogenase inhibitor. Treatment of choice for cheese reaction is phentolamine. Essential drugs is those that satisfy primary healthcare need of population. Post-marketing surveillance is it is phase 4. Which of the following is most active, slowly dividing? It is rifampicin. Drug contraindicated in G6P deficiency is all chloroquine, primaquine, quinine. Which of the following anti-cancer drug are competitive inhibitor of tyrosine kinase? It is imatinib and sunitinib. Which of the following drugs might have caused the effect given in the picture? Goserelin. Ranibizumab is a monoclonal antibody against vascular endothelial growth factor.